At Baton Rouge General, we believe that value is a combination of quality care at a reasonable cost that's convenient to the patients. So we are constantly pushing the envelope as it relates to the quality of care that we provide. Baton Rouge General has consistently offered a low-cost environment in our area. We do this by focusing extensively on the quality of care we provide, and we believe that by providing higher quality care, ultimately we're going to lower the cost of that care that is delivered. We also focus on patients individually, so rather than put patients into a cookie-cutter kind of process, we give them individualized care plans with the hopes that we're going to decrease unnecessary procedures and ancillary services that they would need to be provided. So we meet regularly with our Blue Cross partner in the care of the patient. So our navigators will meet with Blue Cross weekly, monthly, in order to review patients' experience as well as gaps in patients' care. So we're always looking for opportunities to find holes in which care may be provided and fill those holes. That may mean patients need to have an appointment with physicians. That may mean that we need to make sure they're up to date with their regular screenings. But whatever the patients need, we try to provide. Baton Rouge General has consistently ranked in the top tier of Blue Cross's quality programs. Our physicians individually have received numerous awards for chronic kidney disease, for hypertension, for diabetes management, for vascular management. We also have a highly ranking burn center, a cardiovascular center, and a cancer center. Baton Rouge General has continued to expand its footprint in our region. We have grown our primary care network to provide access to patients. We have reopened the Mid-City Hospital to provide several choices to patients as it relates to hospitalization. And we've expanded our emergency rooms, reopening the Mid-City campus, opening the Ascension campus to provide 3 different ERs in our area. Easy access to same-day appointments. Hopefully we'll provide patients with the urgent care needs that they need prior to using the emergency rooms or hospitalizations, and hopefully lower costs. We also are very aggressive about staying on top of patients' chronic conditions to address any issues as they arise, as opposed to waiting for them to develop into a more costly situation. Community Blue patients have lots of options as it relates to finding high quality, low cost, and convenient care.
We are a member of Community Blue and we're a member of Precision Blue, and the value that we bring to it is we're one of the highest quality, most cost-effective groups that Blue Cross contracts with in the state of Louisiana. Precision Blue and Community Blue have the ability to be sold at a reduced price from other Blue Cross products, and as the largest independent physician practice in the state of Louisiana, we feel obligated to our patients to be a part of both of them, and the patient can choose which product that they want to choose for whatever their reasons may be. But we're very patient-centered, and we like to do what our patients want. Anytime that you're dealing with patients, whether they're healthy or whether they do have a chronic disease, it's the ability to interact with them. It's very, very difficult to take care of a patient from afar. So if they have a chronic disease, the key is keeping them out of the hospital because that's where the real expensive aspect of healthcare takes place. So you must reach out to this patient population and get them in to see a physician to make sure their diabetes is under control, their hypertension, renal disease. On the healthy side of the equation, no matter the age of the patient, you need to get them in at least annually, and in some cases semi-annually, to make sure whatever preventive measure you're trying to make sure that they have, whether that be colon cancer screening, breast cancer screening, weight control, whatever the situation may be. That can only be done by interacting with the patient. We have a patient satisfaction rating of 75% or plus, and by that, when I say patient satisfaction, that's where somebody said they would return to the clinic or recommend it to a family, friend, or neighbor, so we're very proud of that as well. We've been here for 75 years. We've been blessed to have a lot of accolades. Our active patient population of over 300,000, so roughly we probably treat close to a third of the Greater Baton Rouge area, or a little more than a third. We're very proud to partner with Blue Cross on many, many things, and be glad to take care of anybody's patient.
Precision Blue and FMOL-HS are mutually focused on doing what's best for our patients. So we work together, we review data, we meet often, and we try to figure out what's the best way we can deliver care for those patients. So in the end, what that means is better care for the patient, a big decrease in cost, and ultimately a better experience for the patient as well. It's really about value, right? Value, value, value. We know that employers want to find the best employees. They want to attract the best employees, and of course those employees, they want them to stay healthy because then they don't have problems with absenteeism and presenteeism. So we really focus on making these offerings focused on keeping the patient healthy, and also that happens to keep costs down, which employers also like. And because of our relationship with Precision Blue, we're able to offer a lot of services that we just couldn't otherwise in a traditional healthcare model. So we have specialized care and manager nurses who really get to know the patient. They're able to help them to answer questions about their health conditions. They're able to do education on how to take their medicines in the best way. We also have specialized partners called CCPs, or clinical care partners, that work with physicians to make sure that we close all those gaps in care. Again, making sure that people get the care they need at the time they need it to make sure we keep them healthy. So we're constantly watching our data on costs, we're watching our data on our outcomes like hypertension and diabetes. We measure ourselves on colonoscopy rates and mammography rates because we know if we give the right care to the right patient at the right time, we'll keep them healthy and again, avoid the need for rescue care. So one thing I'm really proud of is that we're able to decrease costs by over $100 million while improving outcomes, which is really what's at the heart of value-based care. It's important for our group to be part of the Precision Blue Network because we're a mission-driven organization, and the best providers in this region have chosen to work with us because they share our values. So that's really important. They want to keep patients well. They want to work with us to make sure that they provide that great care, fits with their values and with our mission.